This is Dr. Adel Bondak, Professor of Anatomy, Mansoura University, Egypt. I will talk about the TMJ, temporomandibular joint. I will talk about the type, the articular surfaces, the articular disc, the accessory ligaments, the arterial supply, the nerve supply, and the movements which occur at the TMJ. Start by the type and the articular surfaces. Okay, so we'll talk about the type and the articular surfaces. Remember, it has a condyle. This is the condyle of the mandible, so it is condylar synovial joint. It is biaxial actually, okay, or compound synovial joint. It is condylar synovial joint. Articular surfaces from above. This is the articular tubercle, and this is the mandibular fossa. So mandibular fossa and articular tubercle. This articular tubercle is very important in preventing dislocation of the head of the mandible. Below, okay, so this is above. Below it is the head of the mandible. This is the head of the mandible. This is the condylar process of the mandible. So the articular surfaces from above, mandibular fossa and the articular tubercle, and from below it is the head of the mandible, or the head of the condylar process of the mandible. Regarding the articular disc, this is the articular disc. This disc divides the temporomandibular joint into two cavities, cavity above and the cavity below. The upper cavity permits protrusion and retraction, permits forward movement and backward movement. The lower cavity permits rotation of the mandible, upward movement and downward movement. So the articular disc divides the joint into two cavities. The upper cavity permits protrusion and retraction. The lower cavity permits elevation and depression. That's why the TMJ is a compound synovial joint. Regarding the accessory ligament, three ligaments. This is the first one, lateral temporomandibular ligament. This lateral temporomandibular ligament is attached between the articular tubercle and the neck of the mandible, okay, and it limits the backward movement of the head of the mandible. Second ligament is the sphenomandibular ligament. The sphenomandibular ligament extends between the spine of the sphenoid and the lingula of the mandible. And the third ligament is the stylomandibular ligament, and this stylomandibular ligament extends between the styloid process and the posterior border of the angle of the mandible. So the three ligaments, temporomandibular ligament, sphenomandibular ligament, and the stylomandibular ligament. Temporomandibular ligament from the articular tubercle to the neck, the sphenomandibular ligament from the spine of the sphenoid to the lingula, stylomandibular ligament from the styloid process to the posterior border of the angle of the mandible. Regarding the arterial supply, maxillary artery and superficial temporal artery. Regarding the nerve supply, auriculotemporal nerve and the nerve to masseter. Regarding the movements of the TMJ, okay, I told you the upper cavity permits protrusion and retraction. So protrusion and retraction. The lower cavity permits elevation and depression. Actually, regarding the protrusion and retraction, all the muscles of mastication produce protraction except one, temporalis. Regarding the elevation and the depression, all the muscles of mastication produce elevation except lateral pterygoid. So the movements, protraction and retraction. Protraction is forward movement, retraction is backward movement, and then rotation, elevation, and depression. And also side to side movement. So what are the muscles which produce each movement? Start by protrusion, forward movement. I told you all the muscles of mastication except the temporalis, so lateral pterygoid, medial pterygoid, and the masseter. Retraction, It is the temporalis muscle. Okay, posterior fibers of temporalis muscle. Then elevation. Elevation, all muscles of mastication except lateral pterygoid, so temporalis, masseter, and medial pterygoid. How about depression? Depression, all muscles of mastication, it is the lateral pterygoid. It is the only muscles of mastication which depress the mandible, lateral pterygoid, assisted by digastric muscle, geniohyoid, mylohyoid, and the gravity. So protrusion, all muscles of mastication except the temporalis. Retraction, it is the temporalis. Elevation, all muscles of mastication except the lateral pterygoid, so depression is by lateral pterygoid, plus digastric, geniohyoid, mylohyoid, and the gravity. Side to side movement, it is alternating action of lateral pterygoid and the medial pterygoid, or combined action of lateral pterygoid and the medial pterygoid. And thank you very much. Best wishes and good luck.